In today's video, I'm going to tell you the 14 things that happen to your body if you suffer from sleep apnea. If you're new to the channel, hello and welcome. My name is Brian and today we're going to talk about sleep apnea. This is a condition when your breathing stops and starts repeatedly while you're asleep, affecting various bodily functions which slowly affects your body and mind over time. I'm going to tell you the 14 symptoms that appear if you have sleep apnea. So hit that like and subscribe button real quick and let's get into the list. In at number 1, snoring. Excessive snoring is one of the main symptoms of sleep apnea and is caused by an obstruction in the airway. This blockage can cause a person to stop breathing for up to 20 to 30 seconds at a time, resulting in loud, disruptive snoring. Not only does this disturb the individual's sleep, but it can also impact their partners as well. Number 2, high blood pressure. People who suffer from sleep apnea tend to experience an increase in their blood pressure due to lack of oxygen during episodes of apnea. This can happen because when the airway is blocked, the body has to work harder to breathe, and this causes the heart to pump faster and more forcefully than it would when breathing normally. This leads to a spike in both systolic and diastolic blood pressure, which can increase your risk of stroke, heart disease, and other serious medical conditions. Number 3, heart disease. Sleep apnea can cause the heart to work harder due to the lack of oxygen in the body, which can lead to an increased risk of heart disease or stroke. During episodes of apnea, the airway is blocked, meaning that the body has to work much harder and faster than it would when breathing normally. This influx of extra energy can cause the heart to strain, leading to abnormally high blood pressure and an increase of developing coronary artery disease or a stroke. Number 4, diabetes. People with sleep apnea are more likely to develop diabetes due to impaired glucose metabolism during episodes of apnea. The lack of oxygen in the body caused by sleep apnea can lead to a decrease in blood sugar levels and an increase in insulin production. This combination can cause long-term damage to the cells that produce insulin, resulting in impaired glucose metabolism, which can lead to diabetes over time. Number 5, weight gain. Weight gain is another common side effect of sleep apnea due to the disruption of normal sleep patterns and changes in the hormones that regulate appetite. People with this condition are often left feeling tired and groggy during the day, which can lead to an increase in cravings for unhealthy foods and less motivations to exercise. Number 6, memory loss. Sleep apnea can lead to memory loss due to the lack of oxygen that is being delivered to the brain during episodes of apnea. This decreased oxygen supply can impair the brain function, leading to difficulty in concentrating or remembering things. What's more, research has shown that sleep apnea can even lead to an increased risk of developing Alzheimer's disease over time. Number 7, daytime drowsiness. Many people who suffer from sleep apnea often experience excessive daytime drowsiness and fatigue, making it difficult to stay awake during the day. This is due to the brain's inability to get sufficient rest during episodes of apnea, leading to disruption of natural sleep patterns. On top of this, the lack of oxygen in the bloodstream during episodes of apnea can lead to an overall feeling of exhaustion and fatigue. Number 8, irritability. Sleep apnea often leads to irritability due to the lack of restful sleep, which can leave people feeling frustrated and moody throughout the day. Furthermore, the decrease in oxygen supply during episodes of apnea can lead to difficulty in concentrating, making it difficult to complete tasks or stay focused. Number 9, headaches. People with sleep apnea may experience frequent headaches during the disruption of normal sleep patterns. Apart from this, the lack of oxygen in the brain caused by apnea can lead to a decrease in blood flow, resulting in throbbing headaches. Number 10, depression. Sleep apnea can cause depression due to the disruption of natural sleep patterns, the feeling of exhaustion and fatigue during the day, and difficulty with concentration or focus. This can lead to feelings of sadness, hopelessness, and even a loss of interest in activities that were once enjoyed. Furthermore, disrupted sleep from apnea can lead to an increase in stress hormone levels, which can worsen the symptoms of depression. Number 11, anxiety. People with sleep apnea may experience increased anxiety due to the disruption of natural sleep patterns and changes in body chemistry that occur during episodes. This disrupted sleep pattern can lead to an increase in stress hormone levels, which can worsen the symptoms of anxiety. Number 12, lower libido. Lack of quality sleep due to apnea can lead to a decrease in libido, making it difficult for you to achieve arousal or satisfaction in sexual activity. This is due to the disruption of natural sleep patterns and changes in hormone levels that occur during episodes of apnea. The lack of oxygen that is delivered to the body during these episodes can lead to a decrease in energy levels, which can make it difficult to feel aroused. Number 13. Poor immune function. The disruption of natural sleep patterns also leads to a decrease in immune function, which can leave you more vulnerable to illnesses. Sleep is crucial for the body's ability to fight off germs and bacteria, as it helps to re-energize and repair the immune system cells that fight off infection. On top of this, disrupted sleep can also lead to an increase in stress hormone levels, which can further impair the body's ability to fight off infection. Number 14. Acid reflux. Sleep apnea can significantly contribute to acid reflux due to the disruption of natural sleep patterns. During episodes of apnea, the person can stop breathing and the levels of oxygen will decrease. When this occurs, it can cause the lower esophageal sphincter to relax and allow stomach contents, including food and acid, to travel back up into the throat. Finally, in at number 15, sleepwalking. People with sleep apnea are more likely to experience episodes of sleepwalking, which can be both dangerous and potentially harmful if not managed properly. A person who is sleepwalking may get out of bed while they are still asleep and wander around their home or even outside without being aware of what they are doing. Sleepwalking typically occurs during the deeper stages of sleep, when the body is not getting enough oxygen due to the episodes of apnea. These disrupted sleep patterns can make it difficult for a person to reach these deeper stages of sleep and increase the risk of sleepwalking. It is important to speak with your doctor about the potential health risks associated with sleep apnea in order to determine whether you may need treatment. Treatment options for sleep apnea include lifestyle modifications such as losing weight or quitting smoking, as well as oral appliances and surgery. You should also make sure that you get plenty of restful sleep each night so that your body can function at its best. Taking care of yourself is the best way to protect against the long-term consequences of untreated sleep apnea. If you made it until the end of the video, don't forget to hit that like button and subscribe to our channel if you haven't done so already. Also go the extra mile of ringing that notification bell and you will be notified with each new interesting videos just like this one. Stay healthy and thank you for watching.